Morning, everybody. I would like to call this meeting to order. This is some feedback. We're still going here. And we're good? Nope, still echoing. Hang on, we'll pause one more minute. Don't want feedback. And then I'll call this meeting to order. This is welcome to the meeting number 5 of the House of Commons Standing Committee of Health. Pursuant to the motion adopted on Tuesday, September 23rd, 2025, the committee shall commence with a briefing session with the Minister of Health and Health Canada officials. I'd like to welcome our witnesses. And Minister, you will, our witnesses and Minister, you will have 5 minutes for opening remarks, after which you will open the floor to questions. And as you all notice, I am the chair today. Our other chair, Hetty Fry, is sick, so I am in the chair. But I'm going to be taking my questions from the chair as well today, if everybody's in agreement with that, instead of switching back and forth. So thank you, and welcome, Minister.
Merci à tous pour l'invitation.
Thank you for this invitation.
Thank you for inviting me today. Having spoken with many of you over the last few months, I recognize the important work that you are all doing. I also recognize the important work you are doing as a committee. Access to care and international educated health professionals is one of my priorities. First of all, I believe it is important and fair to admit the biggest challenge we have inside our healthcare system is access to care. Too many people struggle to get inside the system and end up at the emergency room for non-urgent healthcare issues. Or worse, a problem that could have been treated earlier by a family physician or a group practice. We need to work in collaboration with provinces and territories to see how we can collectively make things better for patients. And I know my provincial and territorial counterparts are working on increasing the number of professionals trained in their regions. Mais pendant que l'offre de professionnels augmente,
but as the supply of professionals goes up, the demand is going up even faster. Around a third of health professionals trained abroad work in a different sector here, so we really need to do better. In a week's time in Calgary, I'm going to meet with my provincial and territorial counterparts for our annual meeting, and I very much hope that we will be able to make progress to facilitate the recognition of the qualifications and mobility between provinces. I've already had discussions with them, and I have a great deal of hope. I was with Minister Joly at the new Moderna plant in Laval. We need more investments like this here in Canada. That is why we are cutting superfluous red tape and we're accelerating and modernising the approval procedures. We're doing that for approval of drugs. Investments in health in Canada protect patients and increase access to care. And there's also the creation of growth, good jobs, and it reduces our dependence on other countries. We also work with the Anti-Parasite Regulatory Agency, the PMRA, and also the CFIA in order to reduce the administrative burden on farmers.
est au cœur de notre système de santé.
Humans are at the center of our health care system. Tools and innovation, however, also play an important role, even if 95% of physicians use e-records. These are often not interconnected, nor are they connected to the rest of the system. This creates hurdles and unnecessary burdens, in particular in remote and rural and indigenous communities.
Les données sauvent des vies et en mettant à profit l'intelligence artificielle, nous pouvons améliorer la vie des gens, les soins et bâtir un système de santé qui soit prêt pour l'avenir. Je me réjouis de travailler avec vous afin d'adopter des lois pour améliorer la connectivité et le partage de données dans l'ensemble du pays. La santé mentale.
French on the English side.
Is it good?
Okay, she's taking care of it. Go ahead. Thank you. Merci.
Mental health. Before closing, there is one issue I would like to raise with this group. This summer, I did a tour, and there was one topic that came up again and again: mental health. Mental health has been putting immense pressure on our healthcare system over the last few years. Nous sommes confrontés à une crise de santé mentale.
We are confronted with a mental health crisis and also a drug addiction crisis. There's no miracle solution to remedy this, but we have to improve the situation. It's essential for the welfare of Canadians and also to build a strong Canada. The estimated costs related to mental health represent $65 billion per year just here in Canada alone. We all have to work together as parliamentarians, physicians, nurses, and community organisations, as well as the provinces and territories, in order to resolve this issue. I would also like to talk about dental care. Exactly a week ago, we announced that over 5 million Canadians have now signed up to this, and over 2 million people in Ontario alone, and 1.6 million Quebecers profit from this, and also 100,000 and 308,000 in other provinces, as well as in British Columbia. And 2.8 million Canadians have already received this type of dental care, and that means that they can save around $800 per year on average. And 98% of dentists across the country are now participating in this dental care plan. This is good news for Canadians right across the country. And now to round off. In 2024, the health sector in Canada contributed to $301 billion in terms of our GDP, and it represents 3.5 million jobs. So that is 15% of the active working population here in Canada. Let's not forget, in order to contribute to their communities and maintain the vigour of our economy, Canadians have to be in good health. I am here today with several health officials so that we can work together with that perspective in mind. And now I'd be delighted to field your questions. Thank you very much for your attention.
Okay, we'll start with a round of questioning for me for 6 minutes. So, Minister, Health Canada approves supervised consumption sites across Canada. Do you personally review the applications before they're approved by the department? Yes or no?
Les sites de consommation supervisée.
So the supervised drug consumption sites have got an exemption from Health Canada. In fact, it's the provinces and territories that fund those programs.
Personally review the applications
Les applications qui sont
yes or no?
Les applications
The applications that come into the department are reviewed individually each time, depending on the consultations with provinces and territories, organisations on the spot, and also public security.
Here too, so I'll ask the question again. Do you personally review the applications before they're approved by the department? Yes or no? Just oui or no?
Les applications sont revues par le
The
département.
applications are reviewed by the department.
So you've never seen them?
Je viens de vous dire que les applications sont
I have
revues.
just said that the applications are reviewed by the department. There's a process that is in place and they are reviewed individually by the department.
Okay, so you do not personally review those applications. Minister, are you aware that fentanyl is the most used drug in supervised consumption sites that your department approves? Yes or no?
Selon les chiffres que nous avons vus,
According to the figures that we've seen, which are published, we've seen that fentanyl is one of the drugs that's the most used in these consumption sites.
How much fentanyl is consumed in the federally supervised consumption sites?
vous savez, dans les centres de consommation,
In these centres, people use illegal drugs, but these consumption sites have been created, first of all, to save lives. And there's 68,000. We've been able to prevent 68,000 deaths.
Approved supervised consumption sites. Do you know?
je pense qu'il y a du fentanyl, certainement, c'est le plus.
Fentanyl, well, it is the highest consumption, but there are certainly other drugs that are consumed there as well.
Non, des exemptions. Les provinces et les
The
territoires.
federal government gives options, but it's the provinces and territories that actually run these sites.
Is how much fentanyl is used in these sites?
Je vais me retourner vers Antoine.
I will turn to my officials.
The sites are operated by.
I'm not asking if they're operated. I want to know how much fentanyl is used by these sites. How much is the federal government supplying fentanyl into these sites?
Je vais dire à mon collègue, de toute façon, trop.
I would say as an answer, too much.
That your department is approving supervised consumption sites next to daycares, schools, and playgrounds.
Vous savez, les sites de consommation,
The consumption sites, as I've said, they were created to prevent deaths because of overdoses. We examine all of the applications with criteria that include the provinces, the territories, community organisations, and also the public safety services in each province. And it's the provinces and the territories that administer these, and they have their rules.
That the department is approving supervised consumption sites next to daycares, schools, and playgrounds. Are you aware? That's all the question was. Yes or no?
ben, je lis les articles comme vous
I read articles like you that have said that some of these sites are close to schools, and the provinces and territories implement rules. They're the ones who administer these consumption sites. So they set rules according to their criteria and their issues on the ground.
How many supervised consumption sites approved by your department are next to daycares?
Je pense qu'au total, nous en avons 33 qui sont actuellement.
I think there's 33 that are currently underway, but I can't say exactly how many are close to schools.
I was next to daycare. How many are next to schools?
Je pense qu'il y a 33 au total, mais parce que
There's 33 in total, but in reality, when we grant these exemptions, we only grant them after the analysis and in light of our criteria and after consultation, as I've already said, with the provinces and public safety as well as community organisations.
So, but you are aware that they're next to playgrounds and schools and daycares, but you don't know how many.
ben, écoutez,
Can you
vois,
get us-
je
can
le
you
vois,
table
oui.
that
Je ne peux pas vous le
information?
dire non parce que je vois
I
des articles.
cannot say that. I see articles in newspapers as well, but that does not directly fall under my authority.
Be tabled to the committee?
We can share information about the community consultations that are considered as part of the approval of supervised consumption sites.
Minister, can you commit today that your department will no longer approve supervised consumption sites next to daycares or schools? Yes or no?
Monsieur Mézier, je viens de vous... Oh, pardon.
Mr. Mazier?
It's going to be 6 minutes. It's over.
She has 5 seconds to answer yes or no.
Est-ce que vous pouvez répéter votre question?
Could you please repeat your question?
Commit today that your department will no longer approve supervised consumption sites next to daycares or schools.
Je
Yes
vais
or no?
confirmer que mon département va continuer à
I
travailler.
can
pour
confirm that my department will continue to work to protect the health of Canadians.
Thank you, Minister. On to Ms. Sadu.
Thank you, Mr. Chair.
For
Thank you,
6
Minister, and all the officials being with us. Tomorrow is the World Mental Health Day. I would like to thank all the professionals, what they do, and they are providing mental health care, and want to recognize to the people in need. And also, Minister, thank you for recognizing the federal leadership, and it's a pressing issue. And really want to recognize the federal leadership to the providing services, the care, the people in need, and thank you for recognizing it is an essential issue, and mental health is health. And my questions towards AI adoption in the health system, health increasing diagnostic efficiency within the primary care and emergency setting. Do you think it helped to reduce cost and optimize allocation of medical resources?
Oui, certainement que l'intelligence artificielle
Yes, certainly. AI is a tool that's very present increasingly in the healthcare sector. And as you've said, it means that those who use this can cut down on administration and also really focus in on the care that we proffer to patients, including with mental health. There's more and more applications that exist, as you know, that have now been set up. We have to work together to get better data, because with better harmonized data throughout the country, the better we'll be able to use AI so that we can offer better healthcare services to Canadians.
Other questions, the Minister. We know many talented Canadians are completing their medical training in the U.S., including family medicine and residency programs, but face barriers when returning home for the practice. Could you share what steps the federal government is taking in collaboration with the provinces and territories to make it easier for these trained physicians abroad to return and serve our communities? As we know, we Canadians need more family doctors, and what steps are Fed taking?
Alors, je vous remercie pour la question et je dois...
Thank you for that question. As I said in my opening speech, this is one of my priorities, to increase healthcare access. And that, of course, means that we have to increase the number of professionals in the healthcare sector. And people who have been internationally trained are part of that overall figure. So I work closely with the provinces and territories, first of all, and they're very open to this now, given the needs that exist. It doesn't directly depend on the federal government, but what we can do is accelerate recognition of qualifications and credentials. There is an ISD program to have recognition of these qualifications, and we also work closely with FIMRAC to see how we can harmonise this and have a national licence when it comes to recognition matters. But we have to always work on this with provinces and territories. But I have to say that this is one of the topics for our meeting taking place next week.
You were there in Toronto Metropolitan University. You toured there. The new Toronto Metropolitan University School of Medicine in Brampton is a major step forward in expanding training opportunities for future physicians. And it is such an exciting opportunities, exciting development for Brampton residents, for all of us. how's the federal government is continuing to support with the new and existing medical schools like TMU to ensure we are increasing the number of Canadians medical graduates, particularly to underserved, for family medicine, underserved areas?
Comme je vous l'ai dit, oui, j'ai visité.
As I've said, yes, I visited that. It was very impressive to see this infrastructure with the School of Medicine. As I've already said, we really work with the provinces. We have programs where we work with them to specifically increase the number of physicians on the spot. So I imagine that the School of Medicine will be able to work with the province of Ontario and the federal government to make progress on this path.
And my next question is, ministers, you talked about data, how we can, collect the data. We often hear about the pressure health system from staffing shortage or ER blockage. Could you talk about how Health Canada is working with the provinces, of course, the territories, to align investment with shared priorities to help deliver measurable improvement for the patients? We talked about AI to reduce the wait time, to lessen the burden in administrative work. But what else we can do to reduce the pressure in the health system?
You have 15 seconds, Minister.
Continue à travailler de proche avec.
Continue to work closely with provinces and territories because they're the ones that deliver the services. We have to harmonise the way in which we receive the data so we can use them in an optimal way.
Bravo. Mr. Thériault, for 6 minutes.
Merci, Monsieur le Président.
Thank you, Chair. And before my questions, I have a prior request because I'd like to recall that in December 2024, I asked Health Canada to show us the Sun Life contract. You've talked about dental insurance here before the committee. We still have not received that. And last week, I asked Mr. Anzac to do this, but we still have not received it. So the Minister has said that she's got a great deal of respect for our work. So I think it would be a lack of respect if this is not actually done this week, and a mark of respect if it is done this week. So, Madam Honourable Minister, in November 2023, well, now we're fast-forwarded to 2025, the Health Committee submitted a unanimous report entitled Increasing Surveillance of Breast Implants, and one of the recommendations in that report was the recognition of disease related to breast implants. Health Canada responded to us by saying that currently, in terms of research that they'd done, they didn't see a cause and effect link. So can you please table the research on which Health Canada has based itself in order to make that type of statement? Are you going to table that information? I'll turn to my Deputy Minister. Can you make a commitment to table this? If the research exists, I have no problem tabling it. But if Health Canada has said this, they're basing themselves on data, and they'll share that data with you. But I'll turn to the Deputy Minister, who can perhaps give more information on that.
Excusez-moi, mais...
Sorry, Madam Minister, but probably I'm going to put questions to your official in the second hour because you're not staying for 2 hours with us. So I'll come back to that. He will have time to give his answer then. Recommendation number 1 stated that there needed to be a register set up for breast implants to ensure they'd be able to collect information and get more information and better inform women, amongst others, about the risks so they could take a well-informed decision, and we could also have recalls if there were problems, and also make sure that we could have research with reliable data and make sure that this was not harmful in the long term. So why are we still waiting to do this? What are we waiting for? Because apart from a few little meetings at an interprovincial level, nothing's really been happening, and this dates back to 2 years ago already. So what are we waiting for? There are examples in the Netherlands, in Australia. So when is this register going to be set up here? And when are you going to take concrete steps so that this actually happens? The file is moving forward. Yes, there's a committee that's been set up, and increasingly we're looking at data in other countries to line ourselves with that and see how we're going to proceed. And we're certainly going to at least give more information to Canadian women on the possible risks linked to breast implants. Well, that's not very convincing. You're going to make a commitment to ensure that this register that was part of a proposed recommendation that was adopted unanimously in this committee, and you're saying you respect the work of our committee, so can you make a commitment to ensure that this register can be set up as soon as possible? And are you also going to set up the committee and that was a preferred option for the Standing Committee of Health rather than your committee of officials? There was a joint committee that had been suggested that's still not being set up. So it would be important for that specific committee to be created as well, because in Health Canada keeps talking about lots of different interprovincial competence matters between the provinces and Health Canada. But in the meantime, 2 years have gone by. And if after 2 years not able to actually do this, then perhaps the creation of this committee that was requested to be set up as quickly as possible would actually allow you to manage to get it up and running as quickly as possible. So creation of this joint committee. And when is the register coming, Minister? I can commit to say that the unanimous recommendations from the committee have been taken into consideration, and I will look at this file and come back to you with clearer answers next time. But I'm making the commitment to look into this to move forward this file. But I've just like to say that you said that we've wandered backwards and forwards between the provinces and territories and the federal government. But I think you realise that we have to work with the provinces. Now, that's why I don't understand all of these delays that have crept in with all of this. How much time is left? Okay, well, I will come back with another question. You have talked about access to health care and that health care is important. Where's health in your mandate letter then? Have you defined yourself your mandate? Because in the mandate letter from the Prime Minister, there's no reference to health at all. So if health is important and if it is indeed a priority, why is there nothing, when we're coming out of a pandemic, nothing about health in your mandate letter? Have you defined it yourselves? Have you defined your mandate yourself? Answer. I'd like to explain to you that the letter from the Prime Minister stated our mission, then asked each of the ministers to set our priorities in light of the mission of the government, and that's what I've done. Could you please table that? Could you table your priorities before the committee? I've just given them to you, but I have no problem in tabling with you. I'll do that.
Mr. Strauss for 5 minutes.
Thank you, Chair. Welcome, Minister. My questions today are regarding the Vaccine Injury Support Program. I'm speaking about it largely because of a very excellent Global News investigative report. In that report, they interviewed the widow of Stephen McDougall. He is confirmed to have died of vaccine-induced myocarditis. He leaves behind 2 little children. Do you know how much money his family would have received to compensate for his death?
First of all of those who have been impacted by vaccinations, of course, it has a great impact on their family. I'd like to start by saying that. Now, this program has been set up after the pandemic, as you know, and it was handed over to a third party to actually deliver these programs. So the government delegated this to the firm that had been designated to run this program. Now, I'm not going to say that we were satisfied either with Auxerro, and we decided to repatriate the program within the government.
I'll agree on that point that the program has been dissatisfactory, but so it sounds to me like perhaps you're not aware of how much he would have been compensated, the family. CBC reports that the maximum compensation allowable under the program as it stands is less than a federal minister's salary. So I'm just asking for your reflections on that. Was his life worth less than a year's salary for a minister?
Je suis pas au courant des détails.
No, I'm not aware of the details as to how much money is given to each patient. And the criteria that we set, is it one flat rate or is it different amounts? But we can certainly come back to you with specific details on that.
So I would suggest that his family should be compensated more than they have been, and I would ask you to reflect on that and perhaps at another engagement undertake to compensate them more than they have been.
Excusez-moi, j'ai les chiffres. C'est jusqu'à 493.
So it's up to 493,000 for the spouse and 78,000 for the children, up to those amounts.
Préciser combien que cette personne a eu.
Now, I don't know how many people have received them and why, because there's an assessment that's carried out on a case-by-case basis, and I cannot give you the details for each specific patient, but I know that it's up to $493,000.
This committee was briefed previously by Stephen's twin sister in the last parliament. She asked for transparency with this vaccine injury program. Will you undertake to provide that transparency that she asked for?
Tout à fait. Je suis prête à donner la transparence.
Absolutely, yes. I'm prepared to provide transparency.
That the vaccine mandates for employment and engagement in society be removed. They have been. Will you commit today to not instituting further vaccine mandates of that nature?
Je vous dirais que
Well, I would say vaccines protect lives. That's proven by science. And depending on the situations which we find ourselves, I cannot say to you today that I'm never going to do that. That's impossible. We'll have to base ourselves on the actual situation, what science tells us. But I'd also like to see that after the pandemic that we've experienced, I think that we are ready if ever something else comes up. And we're able to examine the impacts on people now because we've got some experience. So, of course, we'll look at all this together before we would take a decision.
There's science, and of course we must listen to science, and of course vaccines save lives, but every medical maneuver can also cost lives, as it unfortunately did in Stephen's case. If you had a time machine, would you go back and tell Stephen not to have taken that vaccine?
Comme je vous l'ai dit, la
Well, as I said, the pandemic is something that happened throughout the world, not just here, and vaccines saved lives during the pandemic, because I know that you've already seen the figures, but when we did the modelling, if we hadn't had the vaccines, there would have been far more deaths and far more cases. It's always, of course, regrettable when there are people who have suffered a negative impact from vaccines, but this can happen with drugs also, and it is very regrettable.
And I think that I would advise him not to take it, hindsight being 2020. When will the audit of the Vaccine Injury Support Program be completed? And is the current program still processing claims while that audit is underway?
And that's your last question, so.
As soon as possible. As soon as possible is the answer. As soon as possible.
Those results to the committee, please.
Oui.
Yes.
And we are on with Mr. Iffelson for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister, for coming. There's, I guess, a number of questions come up. I have a few areas here that I'm curious about. This, in regards to supervised consumption sites, is there any evidence that more drugs are being consumed because of the presence of these sites?
No.
All right.
No.
And I want to clarify a comment that was made earlier. It said that there are people being supplied fentanyl at these, at supervised consumption sites, do people not bring their own and then take them in the supervised place? Is that not the case?
C'est exactement pour cela que les
Yes, that's exactly why the consumption sites were set up, so that people who, in any case, are taking illegal drugs, and that's regrettable. No one should be taking drugs or selling illegal drugs, but these people, for lots of different reasons, do use illegal drugs, and the consumption sites have been set up, in fact, to prevent overdoses, so these people do not die. That is the ultimate aim.
So we're in agreement that these sites are not supplying the drugs. That is correct?
Exactement.
Thank you. Thank you.
Exactly.
Do federal or does are supervised consumption sites generally approved or requested in places where intravenous drug abuse is not already going on? As in, do the provinces request approval in places, areas where this is already happening, or do they request it in areas where this isn't going on at all?
Je vous dirais que c'est vraiment le choix.
Well, it really is the choice of the province. The province comes to us with a proposal, and then once the province hands that proposal over to us, we have our procedures such as consultation with organisations, as I said earlier, with public safety and so on. And sometimes the exemption is not granted if the consultations with the different stakeholders don't give an acceptable result for us.
Great, thank you. I want to change gears a little bit. We talked about, funding for mental health. I work in the emergency department. Mental health plays a tremendous part in what we do in emergency. People come in mental health crises. People with severe mental health issues also don't look after their other, medical issues. They often will not take their insulin if they're disorganized. These sorts of things. Do you see that, in 2016, I know that the federal government attempted to give targeted funding to the provinces, specifically for mental health. I know that that a lot of provinces were resistant to this because they said that, directing this funding was interfering with provincial and territorial jurisdiction. What steps will you and your department take to get cooperation with the provinces so that, between you and the provinces, we can increase the levels of support for mental health?
Je dois juste vous dire que déjà dans les transferts en santé.
Well, we look at the health transfer agreements, the most recent ones with the provinces. I believe that we 25 billion that was added just to take account of mental health. So the provinces have received extra money, extra funding, to address these mental health issues. So we work closely with them, and next week I'm going to meet with my provincial and territorial counterparts who are responsible for mental health during the FPT to see how we can do things better. But I'd like to say that already now, as you've talked about the emergency rooms, I think it's prevention that's really important, the frontline work that really needs to be beefed up. So that's why one of my priorities is to work with provinces to improve access to primary care, because that would avoid, of course, that all of this would lead to overcrowding in hospitals.
That is true. Mr. Thériault, for 2.5 minutes.
Merci, Monsieur le Président.
Thank you, Chair. So still to come back to the committee's report on recommendation 10, where we recommend that there should be funding for research on breast implants so that we can understand the long-term effects on women's health. Now, given the fact that long-term research that was asked for by Health Canada was actually abandoned by companies without Health Canada actually reacting or correcting them. So 2 years after we started, or the study on data, those who carried out long-term research had lost 40% of the women who were actually included in their study, and 80% of the participants had been lost from Montreal, who's meant to carry out this study after 3 years, and no other study on long-term effects has been actually demanded by Health Canada. So there's still no register either. It said that the chicken or the egg. How can you actually look at women in the eye and see that the breast implements, where Health Canada is responsible to make sure that they're totally safe? So how can we make sure that they are not receiving a breast implement? Because in fact we don't know the effects of this, because we have no data at all on this, and it was your responsibility to deal with this. 30 years ago this problem first arose, and it's still not been resolved. Are you not feeling a certain amount of shame? The provinces and territories and the committee, they'll consider this to receive data. Health Canada has to deal with the safety of medical instruments that are high-risk medical devices, and they don't know what they're doing. Why are you not applying the precautionary principle here? Because according the precautionary principles, you've got no long-term study on the effects, and there's lots of studies throughout the world that's shown that there are long-term effects such as cancer and disease, which we call the breast implant disease. If you want me to give you references, I can do that to see the research that's been carried out in this throughout the world. I can pass these on to you. For 30 years now, Health Canada has been dragging its heels on this file, and I'm saying, why is that the case? Why are we still not able to make it?
Unless you were looking for a response there.
I
just wanted to say to my colleague that Health Canada in 2024 published a review, a safety review on this. And I imagine you've read that.
La conclusion?
What was the conclusion of that?
Please table those conclusions.
Voilà, on va le tabletter.
Thank you. Mrs. Conant.
Yes, we'll table these.
Sorry, 5 minutes.
Minister, through the chair, in your opening, in your introduction, you mentioned that the drug addiction crisis had no clear solution, but I believe there are some things that you can do to help. So in 2023, British Columbia received an exemption from the Health Canada Act under subsection 56(1) of the Controlled Drugs and Substances Act, what we know of in BC and through the country as decriminalization of drugs pilot program. Can you confirm that this exemption is still in effect, yes or no?
Le gouvernement de la Colombie-Britannique a...
The government of British Columbia did receive an exemption, and that still applies.
Okay, thank you. And do you have the ability to suspend it at any time? Correct? Do you have the ability to suspend it at any time, yes or no?
Nous travaillons avec le gouvernement de la Colombie-Britannique.
We work with the government of British Columbia closely to see what the next stages will be.
You do have the ability.
En travaillant avec la province de la Colombie-Britannique,
working together with the province of British Columbia, we can take a decision together.
So you can't make the decision to end that right now? Yes or no?
Je travaille de proche avec la Colombie.
I work closely with British Columbia. As I've just said, the delivery of healthcare services depends on provinces, and I work with them.
David Eby, who once requested this policy, now says he was, quote, wrong on decriminalization. It was not the right policy, end quote. 6,000 people have died since the beginning of that pilot program. Do you agree with Premier David Eby that this decriminalization pilot program should stop?
Vous savez, une mort dans le pays.
One death due to an overdose is one death too many, and the British Columbian government, as you've said, that the Premier has made that statement. He was the one who'd asked for decriminalisation, and I'm there to work with them to eliminate this problem of the opioid crisis.
Excellent. So now that you know that he would like to end this program, will you work with him to end that today?
Le gouvernement de la Colombie-Britannique a
The government of British Columbia has already asked for changes to be made, and they've asked for a renewal, so we can continue to work with them, and I'll come back to you once the decision has been taken.
So we know that Premier David Eby would like to end this program. 6,000 people have died since it started. Your fellow Liberal colleague, Mr. Danko, said in the House of Commons last Thursday, after reflecting, quote, after reflecting on the British Columbia example of decriminalizing illegal drugs, I completely agree that it was a terrible policy decision. We have seen the fallout in municipalities across Canada, end quote. Do you agree with your colleague, Mr. Danko?
Je vous ai déjà dit que toutes les...
As I've already said, all deaths caused in particular by the opioid crisis are very regrettable, and I work with the province of British Columbia that now wants to go in a different direction. I'm there to support them in that.
You know that David Eby, the Premier of British Columbia, the people of British Columbia don't want anyone else to die, as they have 6,000 since this program started, and even some of your colleagues believe, at least Mr. Danko spoke in the House of Commons, that it was a terrible policy. We've got a few months left of this program. Could you end it now so that no more people die needlessly, or less people die needlessly in the drug addiction crisis, which I know you hold as a priority?
Le programme a été mis en place par la Colombie.
The program was set up by British Columbia, and if the program is to come to an end, we have to work with BC on this. British Columbia seems to want to go in another direction. I'm there to work with them.
But will you stop this program today, knowing that all sides want it to stop and to end the endless deaths in British Columbia?
La livraison des services est la responsabilité du gouvernement de la Colombie-Britannique.
Delivery of services is the responsibility of the British Columbia, not the federal government.
La livraison des services.
As I said, delivery of services is the responsibility of the government of British Columbia, not of the federal government.
Would like to end it. Thank you.
Thank you. Ms. Chi for 5 minutes.
Thank you. And thank you, Chair. You're doing a fantastic job. Thank you for stepping in on a short notice. I appreciate you doing this. And thank you, Minister, for coming to present to committee. And thank you for all the officials who are here today to help us understand, the mandate and health issues that are impacting all Canadians. Just to follow up on my colleague's line of questions. I just wanted to sort of clarify, in order to make a decision on safe consumption sites or some of the strategies or policies around it, does it take the province to formally make a request on something like this?
Yes, it requires that the province make a request. Oui, la province doit faire une demande d'abord.
Yes, the province has to make a request, because we have to understand that it's the provinces that actually give the funding. It's not the federal government. We just grant the exemption. So we actually do have to get that request from the province.
Voir aussi des provinces qui avaient
And we can also see the provinces that approved sites and then decided to not fund them anymore. So automatically the sites closed then.
And this question might be to one of the officials. Have you received a request from the BC government on the program to stop the program or to extend or?
Which program? The decriminalization program? Is that the one you're referring to?
In BC.
Non, pas encore.
Okay. Thank you. And I will
No, not yet.
So, Minister, you mentioned mental health is one of your top issues, and indeed, it was. I've had many conversations in my riding and across the board in the province about mental health issues in youth, especially coming out of the pandemic. It's impacting a whole generation of young people quite a bit. It is definitely a top concern of mine. And I also wanted to ask you to expand a little bit on, your top priority on mental health and how that ties to the Prime Minister's mandate. I know it's a short mandate, but it really impacts many areas. So I just wanted you to expand a little bit on that.
Merci pour la question. Écoutez,
Thank you for that question. Yes, mental health of Canadians, in particular young Canadians, in particular more young Canadian men. We know that the suicide rate is much higher amongst young men, so that is one of my priorities, and that very much fits in with the mandate from the Prime Minister to protect Canadians. And it's also very much linked to the productivity of the population, because it's certain that if the population is more adversely affected, then it's going to be less productive in the economy. And as a result of the research carried out by the Canadian Institutes of Health Research, the CIHR, there's a model for young people which appeared, the Youth Integrated Services. Air Ouverte, it's called in Quebec. And these are centres where young people can go. It's created for and by young people. So they can go to these centres not just to get services, but also to get the right medical support, social workers, and also a gathering place for them. So this is a model that works very well. I visited several of these throughout the country. I encourage you to do the same thing. And I think that in the long term, we have to increase the frequency of visits, but if they're closer to communities, then of course more young people have access to these. Another point that I'd like to mention is as follows. In terms of prevention, there's the 988 line, the telephone line, which has been used by over 600,000 people. And that's an additional tool for the population to obtain services quickly in a crisis situation.
My colleague here mentioned earlier about accessing primary care. Sometimes, primary care physicians and emergency doctors end up being the first point of contact for a lot of people in crisis. And we know, capacity. There is a capacity issue. There is sort of a triaging that has to happen at the first stage, and sometimes the decision is very quick, and our capacity in the system can also be, what can I say? There is a lot of improvement to be made. Just wanted to get your thoughts on, we talk about prevention, talk about catching people early on in the stage. How has your conversation been with the provinces and territories? Yeah, just quickly. Yeah.
If you could table those responses, that'd be great, Minister. Thank you. So, on to our third round, and Mr. Bailey for 5 minutes.
Minister, are you familiar with Canada's tobacco strategy? Yes or no, please?
Yes.
Excellent. Are you familiar with its 4 main themes? Yes or no?
Yes.
Excellent. One theme is helping Canadians quit by providing info and access to less harmful nicotine sources. Are nicotine pouches less harmful than cigarettes? Yes or no? It's easy.
If they are more harmful?
I'll
think
reread
it's
the
not
question
the
for you.
same-
Are nicotine pouches less harmful than cigarettes? Yes
They
or
don't
no?
have the same purpose. It's not the same purpose. C'est pas la même chose.
Okay.
It's not the
Your
same
dep-
thing.
Testified last week that there are a less harmful source of nicotine, which means really they're a great method of smoking cessation. So if nicotine pouches are less harmful than smoking cigarettes, and the Government of Canada's tobacco strategy is to reduce tobacco use to less than 5% by 2035, why is the government making it more difficult to access less harmful sources of nicotine like pouches over cigarettes?
Je pense que c'est parce que les pochettes de nicotine
No, with the
sont
nicotine
mises
pouches, they're put in the pharmacies to prevent young people from using them in order to protect young people. That's one way of stopping smoking, and it's available in pharmacies, but it is accessible, but only through your pharmacies.
For your answer. How does that make sense when children can order these pouches online? Why aren't we regulating the pouches the same way that we regulate cigarette sales through convenience stores, making it more convenient for smoking cessation?
parce que je vous dirais parce que c'est une mesure pour arrêter de fumer.
It's because it's a measure to stop smoking, and the measures to help you to stop smoking are found in pharmacies.
That's not true. Actually, smoking cessation products are found in other places than pharmacies, and this particular nicotine pouch is actually behind the pharmacist's desk, whereas you can find Nicoderm, Thrive, and other products that are right around the till or in other places in the pharmacy. So my question to you is, will you look at reversing this order and allowing regulated sales like cigarettes in convenience stores to make smoking easier to quit?
Pour le moment, je vous dirais que la
For the
décision
moment, I would say that the decision is to keep the nicotine pouches behind the counter in pharmacies to protect young people. And we will continue looking at science and data.
Youth, but right now they can buy pouches online. Wouldn't it make common sense to regulate pouches like cigarettes with age verification at the same point of sale to help Canadians who want to stop smoking?
mais je ne vois pas pourquoi un Canadien
I don't know why a Canadian who wants to use pouches to stop smoking wouldn't be able to go to the pharmacy. I really don't see why.
Simple hours of operation, simple availability. Convenience stores and gas stores are much more available to someone who's trying to stop smoking. And I'll give you another example. It could be somebody who possibly has been tempted to start smoking by somebody around him. The convenience of just being able to go get something to curve the Nicorette. Anyway, I'm going to move on. I would tend to ask you to really reverse the order and allow regulated sales like cigarettes. I'm going to move on. You spoke about mental health in the beginning, and I feel that the Liberal government needs to focus on recovery. I feel that you're enabling. And in October 15th, when you meet with the other ministers, I hope it is a topic that is discussed with other health ministers, how this federal government can work with the provinces to start to deal with this opioid epidemic. Will you please bring it up with your colleagues in Calgary?
oui, c'est déjà à l'agenda.
Yes, it's already on the agenda.
You speak about helping the provinces with doctors. When you meet with the ministers, would you please discuss getting more physicians, helping them with universities, allowing the universities to have more specialist spots for Canadian students?
Je vous l'ai déjà dit, c'est
As
déjà
I've already said, it's already on the agenda for the discussion with the provinces. Next week, we're going to discuss all of these different aspects. We're there to support them as much as possible so that there are as many medical professionals as possible in the system.
For 5 minutes.
Thank you. Chair. Just want to talk about, Minister, we hear about some cancer drugs are approved and funded in provinces like BC, but not yet in Ontario. If a drug is already safe and effective in one province, shouldn't be there on a way to speed up the access to other part of the country. Can you just explain that? Or your official can.
Donc, j'entends la question.
Yes, I understood your question. And it's true that Health Canada's a certain approval level, but in fact it's the provinces that make their choices and decide to pay for certain drugs or not just for cancer drugs, but for other types of drugs as well. So it's work we have to do with the provinces and together with their populations. They're the ones who set their priorities. We give a high-level approval at our federal level, but then the provinces can decide whether to cover the drug or not. That's what the Federation is all about.
The dental care, I know I got a very positive feedback from my riding from Brampton South. Last week, you announced that over 5 million Canadians are now covered under the CDCP and can receive the dental care they need. Millions of Canadians who previously could not afford a dentist now have coverage. In some cases, the first time in years we have been able to see the oral health professionals. Could you speak up how this plan is improving access and strengthening the health and well-being for the Canadians?
Vous savez, ce qu'on peut...
Now, first of all, the dental care program is one of the biggest social programs that we have in the country and in the health area. And what we're already observing is that there's fewer people going to the ER with mouth-related or dental issues, and that's because they now have access to a dentist. So it's quite clear that this program really is helping the population because your mouth health is part of your overall health.
I just want to talk about Minister for Opioid Crisis. You know, mission is save lives and help Canadians affected by the toxic drug supply. From your conversation with medical professionals and community organizations, what step do you see as the most important now to prevent deaths and they can protect Canadians?
Vous savez, la crise des...
The addictions crisis, the mental health crisis, well, as I said earlier, there's not just a one-size-fits-all approach. That's the reality here. When we talk about mental health, there's lots of different reasons that lead people to find themselves in this particular situation. So there's several ways of tackling this. If we're talking about consumption sites or treatment, there's different ways that we have to look at, and drugs are becoming more and more complex as well. So honestly, we're going to have this conversation with the provinces, but provinces are trying out different things. And I don't think we should be too dogmatic currently. Simply, we have to try things. And if it doesn't work, we have to be honest enough to say, look, this isn't working, and continue to find the best direction. One of the good news stories that I've already mentioned with my provincial and territorial counterparts is that they're open to looking at the best practices to know who's tried what so that we can try and get better results everywhere, because it's true, it's a real scourge. Nobody wants to see these deaths, people that are struggling with addictions. This is true for the federal government, for all of us here, but also for the provinces. But they are having to deal with the complexity of what they're observing on the ground.
After this round, but quickly, if you can talk about how you and your team integrated youth services are becoming an important way to support young Canadians with the mental health by bringing different support together under one roof. I know with the federal investment, I know the helpline, how it's helping to expand these services. Could you share why this model is so important and how it's helping, especially to young people?
D'abord, je crois qu'il faut en avoir de plus en
First of all, I think we need more and more of these. So I'm going to continue, or I hope we're going to continue to fund them. I think we've got 108 at the moment, and there's 30 that are underway to be opened soon. But the provinces are asking for more because they've seen the effects on the ground. So I think it's important to get these centres up and running as close as possible to communities so that youth have access to these. They need to have easy access to these centres, and they need to be places where they can meet together. That's why these integrated centres are designed together with the young people.
2.5 minutes.
Point of order.
Madame la ministre,
Point of
vous
order,
avez
Chair.
parlé.
Madam Minister, I spoke to earlier about.
I understand, because it's well over an hour now. I understand the minister needs to leave. Yeah.
I
Ouais,
guess
mais,
that's up to the minister. If she can stay, that'd be
Je
certainly
vais prendre la
appreciated.
question de M. Thériault et je vais y aller après.
I'm going to take Mr. Terriot's questions, then I'll have to leave.
Mr. Terry.
Est-ce que je peux recommencer?
Can I start again then, please, from the top?
À zéro, là?
I'm starting from 0 in my time. Okay. You've correctly referred to the accessibility to care, and you've talked about a potential solution to recognising credentials and so on. But how can you reconcile that with the lack of investment? The indexation thresholds with the health transfer is actually diminishing over 10 years. So that means that the share from the federal government in 10 years will just be 19%, and the provinces will have to contribute 81%, and they're the ones that will have to foot 81% of the bill. So if we cannot meet the cost of the system, we fall down to 3%. How are we going to be able to recruit people? Mr. Thériault. That's part of the conversations with the provinces. The federal government has made commitments in terms of the Canada Health Transfer amounts for the next round. But I believe that everyone agrees, in fact, the health ministers in all of the provinces, and including myself, we all agree that we have to look at the health system with a different lens, given the complexity of needs, the healthcare system and delivery of services. Well, Quebec is in the midst of a 6th reform in this. You're Quebec, you know what I'm talking about. But what I'm saying to you here is, how do you want to ensure that provinces coming out of the pandemic will be able to actually hire more people when the indexation of the costs of the system to pay for people will actually go down for the next 10 years? So how can we recruit more people where we can have recognition of the credentials? If your share of the bill is going down in 10 years' time, it'll be 19 cents on the dollar coming from the federal government only. Well, the provinces and the agreements that we've had with the provinces, well, we're going to continue to work with them for the next 10 years.
She all done? You got 30. You got time left.
On a encore. Du temps?
I still got time?
You got 20 seconds now.
Ah, bon. Alors, je vais juste
Well, I'd just like to make a comment then. Perhaps, yes, the provinces have signed up, but they were asking for 35 cents on the dollar, and they were asking for 28 billion. And 280 billion. They got 3.4 and 46 billion of new money over 10 years. So how do you want us to be able to deal with this coming out of the pandemic and be able to do early prevention in key areas such as cancer, cardiology? There's people, because of that decision that's been taken by the federal government, they are suffering from cancer and they're going to die.
Vous avez les provinces, comme je vous l'ai dit, avec.
Well, as I've said, the provinces have signed these agreements and I work closely with them. The provinces know that the federal government will be there to collaborate with all of the provinces as best I can within a certain budgetary envelope. So there'll be no extra money. So that's why it wasn't Mr. Carney's speech.
Mr. Thanks for extending on.
Thank you to all of you.
A couple-minute break here to get everybody, let the minister leave the room, and then we'll move on to the officials. And I'm up next for 5 minutes. the officials are in the spot.
Yeah.
It's me. It's me. Here we go. Okay. Ms. Weber, do the supervised consumption sites that Health Canada approves distribute needles and pipes? Yes or no?
So Health Canada does approve the exemption request that comes in from the
I
community.
asked
in
about
some of
needles.
The sites,
I asked specifically. It's just a yes or no answer.
so we don't approve the needle distribution. Some of the sites that do come forward and seek an exemption, they do offer programming where they have harm reduction tools that would include clean needles and syringes for the individuals who come in and bring their own substances to the site and are overseen by health practitioners to avoid overdose.
So I'll ask the question again because I'm kind of confused here. So do the supervised consumption sites that Health Canada approves distribute needles and pipes? Distribute needles and pipes, yes or no?
So the sites,
Just a yes or no.
some sites will offer harm reduction tools for
Yes
the
or no?
individuals.
Do they distribute?
There are sites that do provide harm reduction tools, including needles.
And those are needles?
They do include
Those,
needles.
and they do include pipes.
They do include pipes.
Thank you. So how many pipes were distributed through these federally approved supervised consumption site last year?
Thank you for the question. And I should also note, though, that restrictions with SCS regarding inhalation do depend on whether there's a bylaw
How many
in that
pipes?
jurisdiction. So
The question was, how many pipes were distributed through this federally approved site?
And I would make the point, thank you for the question, that we don't actually have a lot of SCS that have approved inhalation. And so I would have to come back to you about pipes because inhalation and smoking in SCS is very limited across the country due to municipal bylaws. So I would have to come back to you
Okay.
with that answer.
For the crack pipes and the needles. Do you collect that data?
No. Because
Don't?
we don't, the exemption is for the use of a controlled substance.
you
in a
don't collect that data?
Supervised consumption site.
Yes.
The supervised consumption site exemption is separate from the provision of harm reduction supplies in the supervised consumption site and the health services. So we provide an exemption for the use of a controlled substance that the individual brings into the site to reduce overdose. And then
I
those
know,
services
I know,
will
that wasn't
also-
my question,
Oh,
though.
sorry. For the,
How many needles were distributed through the federally approved supervised consumption sites last year?
so the consumption.
And you don't collect that data either?
The needle distribution is separate from the actual supervised consumption site
Do
exemption.
you collect that data?
The needle distribution is separate from the supervised consumption. So
Do you collect that data? Yes or no? One question.
it's unrelated. The supervised consumption.
Doesn't
site-
matter, it's unrelated. Do you collect the data? It's a simple question.
The supervised consumption site is an exemption for the use of a controlled substance. under
That isn't the
practitioner.
answer to my question, yes or no question.
Point of order, Chair. Point of order. Can we just let the witness speak, just so we can
She's
all
not
hear
answering my
about-
question, and
Yeah,
I'm
I
the chair,
appreciate-
so I guess
maybe
I got
she's
kind of
getting
say in
there.
this,
Just
right?
giving her an opportunity to get to her thought. I think that would be appreciated for both sides.
Okay,
Thank you.
I'll move on, Ms. Chi. Ms. Weber, Canadians want to know what drugs are being used in supervised consumption sites next to their children's schoolyards and playgrounds. Is crack cocaine allowed to be used in a federally approved supervised consumption site? Yes or no?
The supervised consumption sites
Yes?
receive an exemption for the use of controlled substances.
Okay, correct.
So controlled substances, cocaine is a controlled substance.
Is meth allowed to be used in those sites?
Meth is a controlled substance, and we give an exemption for the use so that a health
Meth
practitioner
is allowed to be
there.
used in these sites, yes?
Individuals come in and use meth, and they use other controlled substances, and they're under the oversight of a health practitioner so that if there is an overdose, they can prevent death.
My next question is for the Deputy Minister. The government is planning to allow 395,000 permanent residents and 673,000 non-permanent residents into Canada this year alone. Can our healthcare system handle the government's record levels of immigrations? Yes or no?
We continue to work with provinces and territories in respect of their health systems and the provision of health services, and provinces are one of the stakeholders that are consulted on the government's immigration plans.
The department conducted an analysis of this.
We would be relying on provinces and territories as part of the health system planning, and they are directly in conversations with our colleagues from Immigration, Refugees, and Citizenship
Do you
Canada.
collect that data, though, for the provinces? Since immigration is a federal responsibility, so do you collect that data so that the impacts on the immigration system, on the healthcare system?
That would be information that the provinces would be supplying to us and would raise with us and our colleagues at Immigration,
Okay, thank
Refugees,
you.
and Citizenship Canada.
If you could table that information, that would be very helpful to the committee.
Excuse me, can you just suspend for a second because
Sure.
we have technical problems?
I got to suspend for a second. For 5 minutes. Oh, sorry. Oh, is it Marcus? Mr. Pawlowski.
So, we just heard a question about making needles available in safe injection sites as though this was somehow a bad idea. I think the evidence is overwhelmingly that clean needles leads to decreased mortality and morbidity, decreased transmission of things like HIV, hepatitis B, hepatitis C. These are people, otherwise you're sharing needles, you end up with these diseases. The cost to the healthcare system treating someone with HIV, hepatitis is obviously enormous. This would seem to be a very wise intervention to be providing clean needles. Perhaps you could comment on the wisdom of providing clean needles to users.
Thank you for the question, Chair. Harm reduction supply tools are exactly that, designed to minimize the negative effects associated with substance use, and they provide safer practices and reduce the risk of infection disease, overdoses, and other harms. And these can include syringes. It can also include a number of harm reduction tools. It prevents infection and infectious disease and keeps the individuals who are using the substances alive.
Thank you. There was also the suggestion made in a question that the healthcare system was being overburdened by the number of immigrants. As someone who's worked my whole life in the healthcare system, I would say if it wasn't for immigrants, our healthcare system would be totally overrun. So many doctors, nurses, PSWs working in hospitals and chronic care homes are immigrants to this country. They're really, I would suggest, the backbone of the healthcare system. Without them, the healthcare system couldn't continue to function. Would Health Canada have any figures, or Public Health Agency of Canada have any figures as to the number of people, foreign graduates, for example, who are currently being employed as PSWs, nurses, doctors in Canada?
There are about 200,000 internationally educated health professionals in Canada, and we recognize that immigration is a vital tool for addressing some of the health workforce shortages that exist in the country.
So I'd like to just personally thank all the immigrants who came here who've helped our healthcare system rather than trying to demonize them as being the problem. I'd like to make clear the whole issue of decriminalization, where BC is with decriminalization. I think I asked this previously, but my understanding was BC asked us to decriminalize, which means an exemption under the Controlled Drug and Substance Act. But later BC asked for that, in my understanding and from your reply, that they wanted the exemption to be removed for public places, meaning that you're still allowed to use drugs in private. There was decriminalization in private, but no longer in public. Is that that's the case? I think. No, have I got that right?
That's correct.
Yes.
Yeah.
Okay. So, and I know Premier Eby came out with some remarks recently saying that decriminalization was a mistake, but has he formally asked for that decriminalization or that exemption that still exists for private use? Has he asked that that be removed as well, to your knowledge?
We, at the moment, to my knowledge, have no further requests from the BC government to change or amend the existing exemption, but the existing exemption does expire at the end of January.
Do we still have time? 1 minute. Dental care. My understanding is that if you have insurance, and I've had a lot of elderly people come to my office and say, I have dental insurance and therefore I can't access the government plan. And they're told that even if they get rid of their insurance, they still won't be able to access the government plan. And it seems kind of unfair for elderly people on limited income that's the case. Can you verify that this is actually true, or does the government actually? How is the government going to know whether you have private insurance or you recently stopped your private insurance?
We have about now over 5 million Canadians who've signed up for dental care. I think the number's up to $5.3 million. A significant share of that are seniors. Seniors were the first ones who were able to sign up for the program. If a senior would have access to dental insurance through, for example, a benefit plan associated with their retirement supplementary health benefits, then they would not be eligible for the Canadian Dental Care Plan. But if they have no access to that kind of private insurance, they would be eligible to apply.
Very good. That's it. Thank you. So we'll go into the fourth round, and Mr. Strauss.
Thank you, Chair. Nice to see the officials again. Ms. Hamzawi, we had a discussion about the FACT Scientific Strategy Report the last time you were at committee. I had one more line of questions regarding that report. The report says, it uses the term humility many times, and it says that PHAC recognizes the importance of humility in the discovery and the use of scientific evidence. Part of humility might be for an organization to acknowledge when it gets things wrong. Do you have any examples of things that PHAC has gotten wrong over the last few years?
Thank you very much, Mr. Chair, for the question. Perhaps what I might do, actually, to recognize the fact that October is Breast Cancer Awareness Month, to reflect on, for example, the data that we have available with respect to the age at breast cancer diagnosis by race and ethnicity. So, for example, the study by Anna Wilkinson, Carmina Ng, Larry Ellison, Jean Silly in The Oncologist in 2024 breaks that down. And what you see in that, essentially a series of bell curves, is that the peak for the age at breast cancer diagnosis for a white woman is around 65 years of age in terms of the final peak. However, when you look at the data for Métis, Black, South Asian, Chinese, Filipina, and First Nations women, the peak is actually earlier. And so as we reflect on how we provide information to individuals in Canada to make the proper decisions for themselves, making sure that we really drill down in terms of the disaggregated nature of that data and provide nuanced guidance and information for Canadians and all people living in Canada to be able to protect their health.
That's terrific. So I take your answer to say that that yes, PHAC has erred in not disaggregating data sufficiently when it gives its recommendations over the last few years, and maybe we look forward to PHAC doing a better job at disaggregating its data under your leadership.
Mr. Chair, for the question. The way I would describe it would be the science strategy outlines 4 key priorities for the agency, and the first is advancing data science and the science of public health surveillance. And so it is a continued journey for us in terms of making sure we have access to disaggregated data in as comprehensive manner as possible.
Terrific. And then I have some questions, and I'm not sure which official will be the best to answer them. Returning to the Vaccine Injury Support Program, the minister, when I asked about how long the audit would take, said it'll be done as soon as possible. Does anyone on the panel have more precise information, a ballpark, how long this audit will take? And also, she hadn't answered the second part of my question, which is Auxaro, the consulting firm, continuing to process claims while the audit is underway?
Thank you for the question, Mr. President, and just to again note, recognizing, and we've heard very clearly the frustration and hardships of claimants through the program, and so we are highly focused on making sure we modernize the program in a very careful and informed way, and so we are very much looking forward to the audit being concluded as soon as possible, and the audit at this point in time is well underway. I would say, sorry, in terms of whether the second part of your question was whether...
Well, the first part wasn't really answered. Ballpark, how long will the audit take?
I do not want to set a firm timeline for the auditors. I'd like to make sure that I do want to make sure that the proper due diligence is done so that we have the best possible advice.
Is Auxaro continuing to process claims while the audit is underway?
Yes.
Those Canadians who, I understood from the Global News reporting, there were 1,500 cases that hadn't even been processed. Are you willing to set a timeline for how long those Canadians who feel they've been vaccine injured it will take them to have their claims even heard?
So as of June 1st, 2025, which is the last report that we've received from Auxaro, a total of 3,317 claims have been received, of which 1,227 claims have been reviewed by the Medical Review Board. We understand that there are 2,303 claims pending review by Auxaro and the Medical Review Board.
And how long will those Canadians be waiting for that review?
My understanding, it takes on average 18 to 24 months. However, again, this is a process that is managed by Auxaro.
Oh, yeah, that's okay. But it's Ms. Sadu. Thank you. Mr. Strauss, Ms. Sadu, you for 5 minutes.
Thank you, Mr. Chair. I will share my time with my colleague, but I will go first. Just want to ask about, could you speak to how Health Canada and federal government are working with the provinces and territories to ensure more consistent and timely access to approved and funded treatment across Canada so patients do not face delays just because of where they live, especially to the cancer treatment drugs?
I will take that question. Thank you for that through the chair. We are working with provinces and territories as well as Canada's Drug Agency, which is the health technology assessor, in ways in which we can accelerate our processes. Health Canada is responsible for reviewing the safety and efficacy of a drug, but there are steps being taken to accelerate some of the health technology reviews, sometimes in parallel with the work that the Health Canada is also doing. And we're also working, for example, with international partners. Oncology drugs is a good example of that, in respect of an initiative called Project Orbis to help accelerate the approval and review of those drugs so that provinces can make faster decisions to add those to their formularies, like the province of Ontario has committed to do just recently.
Thank you. But do you think there's no national framework for that if some drug is offered in BC, not in Ontario? So it's not fair or equity to Canadians. So what do you think about that?
There is a high degree of cooperation and information sharing, I think, amongst provinces and territories, as well as the entities that are involved in the review of drugs. But ultimately, at the end of the day, it is the province and territory that determines what drugs are listed on their formularies. So that is an authority and a responsibility that continues to rest with provinces and territories. But like I said, there is a high degree of cooperation and information sharing, and I do think that that's helpful in terms of how the system works.
And my last question is, I know next month is a Diabetes Awareness Month, and for the management or the awareness, I know any programs from Health Canada is for the awareness, if you can elaborate on that.
Sure. Thank you very much for the question, Mr. President. In terms of diabetes, there is the framework for diabetes in Canada, which was tabled in Parliament on October 5th, 2022, which provides a common policy direction to address diabetes and lays the foundation for collaborative and complementary actions by all sectors of society. In 23-24, we at the agency conducted a scan on diabetes in Canada, and we have also, through investments of budget 2021, there's been $35 million provided over 5 years to, in part, to the Canadian Institutes for Health Research, of which $15 million was matched by Breakthrough T1D. To support type 1 diabetes research through CIHR's 100 Years of Insulin. We have a type 2 diabetes prevention challenge prize, which is $10 million over 5 years with Impact Canada. We had 7 finalists who were announced in July 2024, and in winter, this upcoming winter, we look forward to results being submitted to the panel of judges for review and assessment, and up to 2 winners who will be selected to receive a $1.25 million grand prize. We also have $5 million that has been allocated to the enhancement of surveillance capacity and the development of the framework to really make sure that we have clarity in terms of trends across the country in a disaggregated way. There's $1 million in funding over 3 years for Diabetes Canada to develop an inventory of successful diabetes programs, and we have $1.5 million over 4 years for the National Indigenous Diabetes Association, $250,000 for Diabète Québec to develop a diabetes awareness and education program for individuals of North African descent living in Quebec and allied health professionals. All of that in addition to the support that we provide through the Healthy Canadians and Community Funds, a $20 million per year
there you
program.
Go. Thank you. Well done. Only a second over and all that sentence. Mr. Thériault for 4 minutes.
Oui. Monsieur Rensac.
Yes. Ms. Hornsack, you have set up a committee of officials on the question of establishing a register. How many experts are on that committee?
The committee is made up of provinces and territories. There are, to my knowledge, 9 provinces and territories participating. And
Il n'y a aucun expert, donc?
There's no experts then?
Je dois comprendre.
Is that what I should understand? No experts, yes or no?
The committee has the ability to ask for expert advice, but the committee members are provinces and territories. That's correct.
C'est pas ma question. Ça serait le fun
No,
que vous
that's
puissiez...
not my question. It'd be good if you could really answer my question quickly because I only have 4 minutes. Stop going round and round circles, please. Thank you. So how much independent research from industry have you actually consulted or based yourself on long term to establish that there's no cause and effect between breast implants and the breast implant disease?
Combien?
How much? That's my question.
I apologize. Can you repeat your question?
Combien de recherches indépendantes?
How much independent industry research on the long term has been consulted to state that there's no link between breast implants and the breast implant disease? How much independent industry research?
Health Canada has put out a safety review that is public. And
C'est pas ma question. Combien?
That is not my question. How many studies have you consulted and conducted?
Combien d'études?
How many studies are you basing yourself on? The number, please.
I'll have to get back to you with that in terms of how many studies were reviewed as part of the safety review.
Merci.
Thank you. So currently, on the long term, you don't know how many studies could allow you to state that there's not a link between breast implants and breast implant disease. So let's look at guidelines for breast cancer. The Standing Committee on Health tabled a unanimous report asking the Canadian Task Force dealing with preventive health care to actually cancel this because breast cancer screening, what was recommended was that it shouldn't be extended to women in their 40s. The minister acted. We'd encouraged her to intervene vis-à-vis this committee. So what have you done with that recommendation? Because when we look this up on the site of the Canadian Task Force on Preventive Health Care, the recommendations remain the same. They do not recommend screening amongst women in their 40s. Thank you very much for that question. So the task force has been put on hold. That's a decision that was taken during the spring. So on that specific guideline, it was busy being considered when the committee was put on hold. So it's basically on ice for the moment until we finish the modernization process with this task force. We've learned a great deal with the decade of experience, including experience with this specific guideline. So all of that will be reconsidered when the task force is reactivated.
Your last question. Ms. Conans, for 5 minutes.
Thank you, Chair. I just had a couple more questions concerning the decriminalization and there are some MPs around the table that might feel this isn't important, but I think that this is of very high importance in British Columbia. This is what is being spoken about on the streets and throughout in the stores. People are extremely worried about this. And I think one of the things that shows that this is a very serious situation is the fact that, and I will ask Ms. Weber, have any other provinces applied to join this program or ask for this exemption?
So we do not have any other exemption requests in for review at Health Canada.
And exactly, so no other, and do you have, can you stipulate why there might be no other requests at this time?
Chair, thank you for the question. Each jurisdiction is taking a unique approach to how they're addressing the overdose crisis, depending on the needs of their communities. And in BC, when they came in, it was to put forward a comprehensive approach that included treatment recovery, also harm reduction, and coming in for the exemption for personal possession was something that the province felt was important to their response. And so each province comes in based on their needs.
Okay, so it looks as if no other provinces are interested, and I think it's because it's been a disaster in British Columbia. I think we all know that, and it's been repeated by Premier Eby, but also by Mr. Danko, MP Danko, in the House of Commons last Thursday, who said it was a terrible policy. But I do have another question for Ms. Weber. I'm not sure if I did want to ask this of the minister. Unfortunately, I ran out of time. But I went to the website, to your website, and according to the subsection 51 class 56 class exemption that British Columbia is now following, it says under suspension or revocation, it says this exemption may be suspended without prior notice if the minister determines that such suspension is necessary to protect public health or public safety. So the minister has the ability to stop this at any time. And I was wondering if you were aware of this, Ms. Weber, and if you believe the minister is aware, because she did repeat over and over again that she had to collaborate with the province on this. And yet on your own website, it says that she can make that decision herself.
Mr. Chair, thank you for the question. For these types of exemption requests, it is important that we do hear from the jurisdiction and the organization when they seek the exemption. And if there is going to be a change, such as in BC, we've made 2 amendments to the exemption at the request of BC, and we've acted very quickly in response to those requests.
So excuse me, just because I don't have a lot of time. So you're saying that even though it says in your website that the minister can make that decision, she's not going to, because so that needs to come out of and be changed, or it looks like it's in stone here that you're not the minister can make that decision without consulting with the province.
It's important that we do hear from British Columbia. They came forward with 2 amendment requests. We acted very quickly.
Thank you.
We haven't heard directly from the
I
province.
will succeed on my time to Mr. Strauss. Thank you.
Thank you, Chair. So in the Global News report, it says that the vaccine program company that was contracted by FAC, they took $50 million that were supposed to go to harmed individuals. They kept $36 million, and just the scraps kind of went to vaccine-injured individuals. Meanwhile, there are reports they were watching Netflix at the office, they were playing ping pong, they were drinking. It sounds to me like these guys are swindlers, and so I was really dismayed to hear that they are still processing these claims from the patients who have waited years. Why don't you terminate the contract right now?
Thank you very much for the question, Mr. President. We are very much looking forward to the conclusion of the audit to be able to inform us on appropriate actions that we can take with respect to the legal agreement that we have in place with Oxero.
I'm sorry to not have heard an answer. I would like to see that contract terminated immediately. And I guess the other question is, we're all here talking about it because Global News did this investigative report, but why doesn't PHAC monitor these programs while they're underway? Why did it take an intrepid reporter to find out? Please.
Thank you very much, Mr. Chair, for the question. We have been monitoring this program. An evaluation was concluded back in April. An international review of best practices in terms of vaccine injury programs has also been concluded to help inform the next steps with respect to the program. So there are a number of actions have been taken by the agency to monitor the progress and to inform the way forward, always reflecting the key design elements of the program open and transparent claims process, rigorous causality assessment, efficient administration of financial support payments to beneficiaries, and the availability of an appeals process to the
Okay,
decisions that are made. And a number of interim measures have been taken, including a decision by the minister to move the program into the agency. We are working very closely, very hard on this within the agency, but also tapping expertise across the federal government to make sure we have the best possible program moving forward. And issues that are raised with us by claimants, we are working directly with Auxero to make sure that they address the issues, very important issues that claimants are raising with us.
Thank you. Now you have Mr. Hiflison and 5 minutes, actually. And
Thank you, Mr. Chair. Yeah, we were talking about, there was a reference made before on at the supervised consumption site and the distribution of needles. Are these needles given out to people to use in the community, or are these not used and disposed of on site?
Thank you for the question, Chair. So the supervised consumption sites and also health and community centers do provide sterile equipment, such as syringes and needles. They can be used on site for the substances that they bring with them. Some may leave with them. And so in those cases, it's encouraged that safe disposal does take place. If there is disposal outside of the site, the sites work very closely with community groups and with their own employees to do safe pickup. And also municipalities have programs in place for safe pickup of discarded substance use equipment.
All right, thank you. Do you know how much any one given safe consumption site might actually spend in supplying these safe needles? Any sort of ballpark figure as to what these needles would cost?
No, I don't have a ballpark figure. The supervised consumption sites, the organizations come in and seek an exemption for the possession and the use of the substances in their locations. We do get a sense of how much it costs to run the actual site, but the needles and the distribution are separate programs, and they're often fundings provided by the community, by the municipality, by the province. So the needle distribution programs are separate from supervised consumption sites in that they have different sources of funding, but they are done often in the site or in a community health center.
Now, again, if is it all ballpark as to how much one of these sites would cost per year to run?
I have that with me.
All right. I've been looking up some treatment. We do know this is established that this provision of clean needles does prevent diseases, bloodborne diseases. When someone is infected with these diseases, the cost to our healthcare system for one patient of HIV is between $15,000 to $25,000 a year. One case of HIV can cost, hepatitis B can cost $60,000 a year. Hepatitis C costs about $84,000 for a 12-week treatment cost. We're not spending large numbers of that multiplied by that on these programs. I guess what I'm getting at, would you not be saving more than you're spending on these programs just in healthcare savings on treatment costs of these diseases you're preventing?
Thanks for the question, Chair. So Health Canada doesn't fund the projects, but they are funded by healthcare systems for that exact same reason, because they do see harm reduction as a tool to prevent infection and infectious disease and death. And so the numbers that have been quoted related to the harms and the costs associated with disease are significant, and death as well, when we do not have harm reduction tools in those facilities. But Health Canada doesn't fund the supervised consumption site. It is the community and or the province and territory through the healthcare system budget.
All right, thank you. Now, the issue of crack pipes came up. And a lot of eyebrows were raised about that. Now, correct my memory, this was something I read a few years ago now. Was that program not started because of an outbreak of invasive streptococcal pneumonia in certain vulnerable populations among those inhaling drugs?
Thank you for the question. That could be the case of the source, but you're right about, thank you for the question. It's one of the reasons that harm reduction tools would be used to prevent such an outbreak.
Okay, Mr.
I've still got 40 seconds.
Okay.
Yeah, thank you. Okay, thank you. We've talked about certain programs in the past, like the decriminalization or other things like that. Was there? Would you not agree that data changes over time? What seems like a good plan, and it's a bit of a leading question because I know that much of what I was taught in medical school 30 years ago is now obsolete. Do we not make these decisions at the time because the available data at the time suggests that this is the best policy?
And you're out of time. You can table those comments, please.
A point of order, Mr. Chair. A number of speakers have allowed them to answer the question even once their time is up.
I know, and that's the problem.
No, the problem.
We all have meetings to go to.
No,
right?
I understand that, but a number of other speakers, once if they've asked the question within their time,
So you
have
do
allowed the
realize you're
patient to
taking up
answer.
more time, so you can't find your answer, right?
No.
Point of order.
Point of order. Other speakers have been allowed. Once they finish their questions, even if the
Go
time is
ahead.
out,
You
are
can
the
answer
witnesses
the
allowed
question.
to answer the
Please
question?
go ahead and answer the question.
Thank you.
Thank you.
Briefly.
So
15
when,
seconds.
So when BC did come in to seek an exemption, it was part of a comprehensive approach, and we put in place requirements in a letter from the Minister to BC to monitor very closely the progress on decrim as it related to the
And you've
uptake
got your
of
answer.
background services. So
And I would ask again, please table those remarks and all the results from that study, please. Thank you. Mr. Bailey, 5 minutes. And just so everybody knows, it'll be Mr. Bailey, Ms. Chi, and Ms. Theroux for 2.5 minutes. And that'll be the end of the round.
Deputy Minister, you testified last week that nicotine pouches are a less harmful source of nicotine. So if nicotine pouches are less harmful than smoking cigarettes, and the Government of Canada tobacco strategy is to reduce tobacco use to less than 5% by 2035, why is the government making it more difficult to access less harmful sources of nicotine like pouches over cigarettes?
So nicotine patches continue to be available for those seeking them, but
the minister gave us that answer before. I know about youth, and what I'm looking for is an answer that we're looking at reintroducing them into convenience stores.
So the answer I can give you through the chair is that we'll continue to monitor the situation, and if there's evidence that the concerns that have been expressed by health professionals around unintended use by youth no longer being an issue, Health Canada would review the oversight mechanisms that currently exist for the sale of nicotine replacement therapies.
Mark Holland was on a personal crusade that banned pouches to pharmacy counters. This made it much easier to purchase a pack of smokes than it is to find alternatives to cigarettes like pouches so that Canadians can quit smoking. How does that make any sense? I ask you again, how does it make sense, Deputy Minister?
At the time of the former minister's decision, there were concerns expressed as it relates to the appeal of these products and the availability of products for youth, and the minister took some steps in response to that.
His personal crusade, yes. Given the Liberal government and the minister having identified speeding up drug approvals as a priority of national and economic significance, what has the department done to pursue regulatory reform, speed up drug approvals in Canada?
Thank you for the question, through the chair. We have made a number of commitments in respect of continuing to support increased access to treatments for Canadians. One of the initiatives that we're committed to is to work more closely with our international regulatory partners in terms of work sharing and reliance, and we'll be taking further steps
Thank you.
in that
Thank you.
regard.
So working with other countries, so not really Canadian based. That was the answer I was looking for. I'm going to jump around to this Auxero again. Are we going to claw any money back for their failures, or are we just going to allow them to have the $36 million that they took to the bank and allow them to laugh at us? Are we clawing that money back, or are we just allowing them to keep $36 million of taxpayer money?
Thank you very much, Mr. Chair, for the question. We have an audit in place right now that is looking very carefully at all of the expenditures and processes, and we look forward to the results of that audit to inform appropriate actions moving forward.
All I can say is when. I think that Canadians deserve more of an answer, and the fact that they are still running this is appalling. I'm going to go to another question. Again, is it easier to pick up a pack of cigarettes? What is it? Why are you so against the appeal of convenience stores selling nicotine replacement pouches? You keep telling me youth, but I don't buy that. I think of the person that's quit smoking that needs some nicotine replacement. Why won't you allow them to sell it in a convenience store?
So the pouches continue to be available through pharmacies, and as we've discussed around this table,
yes, and alcohol is sold in stores. You've told us the same answer now 3 times, so I'm going to quit asking it. I'm going to move again on to the Canadian Health Act. The minister had indicated that she is looking at access, which is one of the 5 pillars of the Canadian Health Act. Are you aware of any things that you've been looking at as far as changes go to the Canadian Health Act?
Very quickly.
The government remains committed to publicly funded and universal health care for everyone, which the Canada Health Act protects.
That's okay. That's what you got for an answer. Could you table any of those results of the question?
I think I've answered the question.
Please table those, what you referred to. Ms. Chi, for 5 minutes.
Thank you, Chair. Just a couple of follow-up questions to a few programs and issues I raised earlier. With regards to the vaccine injury support program, while the audit is being conducted, I was wondering what are the interim measures in place to ensure the program is delivered in a timely manner, supporting folks that really needs the access to it.
Thank you very much for the question. And with the benefit of analysis that has been undertaken over the past several months and over a year, a number of actions have been taken. One, the minister has already taken the decision to move the program to within the Public Health Agency of Canada, and we are working very closely, very hard on this to be prepared to take on the program. April is when we are currently targeting to onboard the program, but I can tell you that this is a very active space for us. We're working very closely with colleagues interdepartmentally to take advantage of their expertise, for example, with Service Canada, with our colleagues with Innovation, Science and Economic Development who have comparable kind of programs that we are absolutely learning from and building upon. We also, in parallel, absolutely recognize and have heard from claimants who are experiencing frustrations and hardships through the claims that they currently have submitted to the program. We are following up directly with Auxero through there is pre-existing governance that protects the third-party nature of the program at this point in time. But recognizing the independence of the program, we are still working with Auxero through the appropriate governance to be able to make sure that these issues are considered carefully by the program.
Oh, thank you so much. And one last question from me, and then I'll be sharing my time with my colleague, Dr. Pawlowski. My understanding on the nicotine pouch issue is that Minister Holland's decision was due to the flavor component that would impact youth. Is it true?
There were a number of reasons that you found the products appealing, including the flavors that it was made available in, and some of the packaging and the promotion of these products for in ways that were appealing for youth.
Thank you, and I'll see my time to.
I thought a corollary to that was that kids would start by vaping and the possibility that they would move on to smoking as a result. So there was a concern about it was the kind of entry level for a much greater problem. Is that not what was in the minds of those who are trying to regulate access to these products?
When it comes to the availability for youth, these pouches contain nicotine, and the concern was that with the widespread use of pouches, it could lead to nicotine dependency by youth.
I want a follow-up question on the dental care issue. So I understand in your response, so okay, if as part of my employment benefit plan, I get dental insurance when I'm retired. Yes, our government program shouldn't supplant that, but there are quite a few people that I've heard about in my riding who continue to pay for their dental plans. They had a dental plan before our program came out. They were paying into it, and now they're being told you won't be covered, and if you stop paying into your program, you still won't be covered because you can't. Once you've had insurance, you can't just cancel the insurance and get the government plan. Is that true?
So if there are sort of specific issues with your constituents, we're happy to look at that on a case-by-case basis, obviously. In respect of the way we sort of assess compliance and availability of dental plans for individuals is there's a requirement for employers or pension plans or benefit providers who issue T4 slips, T4A slips, to indicate whether that individual, your constituent, has existing access to a dental care plan, and that's how we determine eligibility for the Canadian dental care plan.
That's it. Thank you. Mr. Tirole, bring us home. 2.5.
OK.
Mr. Harnsack, we know that breast implants cause cancer, autoimmune diseases, and the breast implant disease. But over the last 30 years, Health Canada has accepted and approved that we actually use these high-risk medical devices without ever giving us the means to actually have correct analysis about the long-term effects, analysis from industry. Is that correct, my understanding?
So thank you for the question through the chair. What information was available and the department was able to review, it was not possible to determine whether there is a direct relationship between breast implants and some of the symptoms and diseases that have been reported.
But for the last 30 years, you've never asked for an independent analysis to be carried out by industry. So what's your basis for approving these high-risk medical devices? And why, when it comes to the cause-effect link with the breast implant disease, given that you don't have anything available from a scientific point of view, why do you not apply the precautionary principle so that a directive could be sent to GPs' offices so they could verify this cause and effect link rather than treating women's symptoms here, there, and everywhere? And it wouldn't cost you any more to do that.
So Health Canada has been proactive in terms of informing Canadians and medical practitioners about the risks associated with breast implants. We've made more information available to the public and to practitioners as well, based on the studies and the information that the department had reviewed.
La base des études et des informations de
And the
l'industrie.
basis of the studies from industry doesn't even cover the long term. We're talking about facts that has already been collected.
So the department, to my understanding, reviewed a number of different sources of information, but the department at the time was also advised by a panel on women's health who were made up of experts, including the department's medical advisor.
Very good. And that brings us to conclusion. Thank you very much to the witnesses for coming out today. Just some housekeeping before we take off here. Based on our calendar, we are going to be, when we return after our constituency week, we are going to continue on with the impact of, is that it? Oh, yeah. The committee will finalize the women's health, then commence on the study of impact of immigration policy. So we'll finish up the report and then we'll go on to that one. And then please bring, just a reminder too, witness list for our immigration study is due tomorrow at 4 p.m., 5 p.m. So, and I understand that there's not many names sitting in the docket for the clerk to work on. So please forward those witness lists by tomorrow. Thank you. Have a good day.
Thank you.